The Dental Minute television program highlights a select group of local dentists and dental specialists in an on-camera interview segment. The dental professionals featured have committed to presenting the very latest in information on medical advancements and technologies in an effort to ease any anxieties that one may have regarding dental visits and to encourage regular dental visits. Hi everybody, I'm Rich Fisher and welcome to a brand new program we're calling the Dental Minute. Now before I get started, let me explain a little bit about what it's all about. You're going to have the opportunity to hear from some of the most professional and respected healthcare professionals in the entire metropolitan Detroit area. Our special guests will be providing you with valuable information about all forms of dental healthcare services, including my favorite, painless treatment. They'll talk about their pay plans and a whole lot more. But most importantly, you're going to get to meet these dental healthcare professionals up close and personal. Remember, knowledge is power. So let's get started in just a moment.
Finding a dentist who can meet the needs of your entire family is very important.
I always believed in taking care of my teeth. My sister used to be so fearful of going to the dentist.
Not anymore. Everything is painless now.
Hello, I'm Trisha Alexander. If you or your family are in need of professional dental care services, please write down the phone numbers of the dentists you see here on our program or the numbers you see on your screen and make that call. You'll be glad that you did.
Welcome back. Recently, I had a chance to sit down with some of the best dental health care professionals in the entire metropolitan Detroit area. Take a look. Dr. Stephen Moss is here with us, and I'm very glad to, because I like the name of your office. It's called Moss Dental Excellence, and you specialize in comfort technology. Talk a little bit about that.
That's correct, Rich. At Moss Dental Excellence, we are a comfort tech dental office, and we're associated with two other offices in the area, whereby for the past several years we've been involved with sedating patients for their dentistry to get them to a point where they can actually wake up and feel fantastic about having their teeth fixed.
You know, what are some of the things, some of the changes, especially the important ones that you've seen since from the time you first started till today?
Well, I would have to say one of the greatest technologies that's come my way has been the technology of CEREC dentistry. CEREC dentistry is the ability to take a laser picture of a tooth without using an impression and design with a CAD/CAM system on a computer an exact fitting replica that's milled out in the office and fits directly inside the person's tooth. The vast majority of the time, we do not have to cut the tooth down to a little peg in order to put a crown on it. We're able to place this right inside or on top of the tooth, keeping it a very, very conservative form of dentistry.
How do you deal with patients that come in and they haven't been to a dentist for 10 years or 12 years or 15 years?
One of the largest things that I think my staff and myself focus on are getting to know the patients, the relationship that we build with the people, finding out what their interests are, what their wants are, their desires, and what's kept them from coming in for so long. By hearing them out,
Sure.
we're able to then take the time to give them whatever their dental vision is.
This is a lot of hands-on, one-on-one doctor-patient relationships.
Exactly. And the staff that we have in our practice make it a very, very smooth, easy transition for the patients, and they help me to be assured of always having just a lot of fun with what I do.
Yeah. And having fun is a part of any profession, no matter what it is.
Well, I sat down long ago, and one of the wisest people I ever came across said to me, if you're not having fun, you should find something else to do. And I absolutely love doing what I do.
Well, and obviously you're very successful at what you do as well. Thanks so much for being with us and sharing your expertise. If you'd like to know more about Dr. Moss's practice, our phone number's on the screen, and visit our website. And if you're a dentist out there and you like what we're doing here and like to be a part of the show, do the same thing. Give us a call or check out our website. We'll be right back.
Enhancing your appearance and self-image can bring out that beautiful smile.
I never thought my kid would enjoy going to the dentist, but it's all about finding that right dentist.
And welcome back. You know, I love some of the names of the dental offices from the dentists we've been talking to today, and this one particularly struck me. It's called Gentle Touch Dentistry with Dr. Dana Greer, and you're located in Lathrop Village. How did you come up with that name? I like that.
Well, most of my patients tell me that I'm very gentle and they've never experienced dentistry quite this way, and pain-free, painless. So one day a patient told me, you know, well, you have the hands of an angel. You should name your practice Gentle Touch. And at that time, the practice didn't have a name. It was just my name. And I'm like, that's a good idea.
If a patient is going to say that, other patients must feel the same way. Do you do anything special with the patients in your practice?
Well, we tend to talk to them and relax them. We play very relaxing music. We sometimes cut the lights off and have some candles going just to create almost like a spa-type atmosphere to make them very comfortable.
How did you get into this?
Well, I always knew I wanted to be a dentist since I was a little girl, so I just had a straight path and I knew what I wanted to do, and I'm very good at it, and I just went straight for it.
Well, I can tell you one thing, your smile is a walking advertisement for what you do. You have a very, very beautiful smile, and I'm sure that helps in putting your patients at ease. Dr. Greer, tell us a little bit about your practice. You do basically family practice?
We do basically family practice. We do kids, adults. We do all forms of dentistry. I feel that my patients really like to practice because they don't have to get referred out for many services. We kind of do everything there, from braces to oral surgery to children, endodontics. So they like the fact that they can get everything done right at my practice.
And one-stop shopping, is that what you do?
Mm-hmm.
Yeah. Dr. Dana Greer from Gentle Touch Dentistry, and you're located in Lathrop Village on Southfield and...
Between 11 and 12.
11 and 12 Mile Road. Guys, thanks so much for being with us today.
Great to be here. Great to be here.
First of all, tell us where you came up with the name.
Well, both Brad and I did our residencies at Harlem Hospital in New York City. And so the Harlem Renaissance is real near and dear to both of us, the tradition of the Harlem Renaissance. And so from that name, we picked Renaissance Endodontics for our practice.
All right, guys, let's talk a little bit about endodontics. Is that not just a fancy word for root canals?
Well, actually it is, and a lot of people are afraid of the word root canal.
Yes, they are. I'm one of them.
It's one of those scary things, but we try and make folks understand that it's not as scary as it used to be in the days of the past. What it actually is cleaning out and disinfecting the entire canal system of the tooth and diseases of the pulp, which is the nerves of the tooth.
How do you make them feel comfortable and help them along this process?
Well, we try and maintain a spa-type atmosphere as far as our practice goes. You need a level of comfort to understand that we do care about the problem, we do understand you're in pain, and we want to help you as best we can.
What does that mean, a spa-type atmosphere?
What that means is the use of aromatherapy in our office. Patients are greeted at our door with a fountain that is cascading down in the waiting area.
You've got to be kidding me. Aromatherapy? I love that idea. That's great. How does this work?
The thought was just to try to get a patient away from the ideal of coming to have a root canal done. The thought was to go to a spa. We all like the spa.
Absolutely.
What happens is when a patient comes in, they're generally nervous, as should be expected when you're coming in for an appointment to have a root canal. So what we do is we try everything that we can to get the patient's mind state at a place where they're calm and relaxed, as opposed to tense and anticipating some type of painful event.
When do people come to you? Is it when their jaw is out to here and they're in a lot of pain and their family practice dentist says, you know what, you guys got to go see a specialist?
You've got it right on that part about the general dentist sends to us and refers to us. We do not want to see them until their jaw gets to that point. We would like to see them when they're pain-free, but many times we can detect a root canal problem or endodontic problem before they get to the point of swelling.
Okay, why did you guys want to set up here in the metropolitan Detroit area?
Well, this is a place that's near and dear to our hearts. We're being from the metropolitan Detroit area. We felt the need to come back home from New York, and after we finished our specialty programs, to treat our neighborhood, to treat our families.
Gentlemen, thanks for being with us. You've certainly enlightened us in an area that certainly scares a lot of people. That's getting the old root canal. Dr. Todd Esther and Dr. Brad Griffin from Renaissance Endodontics, right here in the metropolitan Detroit area. If you'd like to hear more about these guys and our other dentists we've been talking to, please give us a call or contact our website. Thanks, guys.
Thank you. Thank you.
There's nothing like having a confident smile. Healthy teeth and gums can boost that confidence.
Welcome back. Well, while doing this program, I had a chance to meet some terrific dental healthcare professionals in our area, and I got to tell you, I was amazed at some of the things that I didn't know. Let's find out more right now. Very, very happy to have Dr. Keith Kelly with us today. Dr. Kelly's office is located in Troy, and one of the things we haven't talked about so far yet, and you deal with this a lot, and that's laser treatment. Tell us a little bit about that and about your practice.
Well, geez, lasers have really come to the fore in dentistry now. You can use lasers to not only detect the cavities, but treat them at an early stage, or use a little air abrasion, which is kind of like a dental sandblaster, way before you need to use anesthesia. So that means you can fix cavities without shots.
Okay. I was going to say that it sounds like, and I think this is going to be a very nice thing for dental patients, that you're eliminating as much pain as you possibly can.
Oh, absolutely. We have anesthetics that numb people up as more than they've ever been before. We have topical anesthetics that often will take the place of anesthetic, the injectable type of shots.
Sure. I think a lot of people still are afraid to go to the dentist. When you see a patient that literally is afraid, how do you go and calm that patient down to make this experience very pleasant?
What we try to do is we try to make anybody who calls into the office, actually part of our family as well. That means you listen to them. Sure. You focus on what they're saying. You find out whatever it is that they want and do what you can to deliver that.
I mean, everybody wants a nice, bright smile.
Absolutely.
And now, in this day and age, you can do that.
Sure, sure. And we can give them a simulation, before it is actually done.
That's amazing.
We can do just like in your industry, we take the digital photographs, and we can modify those photographs, create the smile that they want, and then plug it right back into their smile or into their face and say, is this what you were looking for?
Dr.
Great.
Kelly, thank you very, very much.
Absolutely.
And we'll be right back. Thanks.
There's nothing more frustrating and distracting than having a toothache. Thank God for Metro Detroit dentists.
Okay, this is great. Now look, if you need a dental health care professional, be sure to write down the phone number of one of the professionals you're seeing on this program, or contact us through our phone number or our website. Right back. Dr. Nicole Fields is with us now from Fields Best Dentistry. I love the name of your office. How'd you come up with that?
Well, I feel like I want to give my patients the best care. I want them to feel comfortable when they're in my office. So that's how I put it together. I want them to feel good when I give them the best dental treatment.
Where does that feel good feeling come from? The minute your patients walk through the door?
Exactly. I have a wonderful team that works with me. They are very customer service oriented, and so they always make they always greet the patients with a smile. So I think that's very important.
Dr. Fields, you I think are in somewhat of a unique position because you also taught, especially some of our younger members of the community, dentistry. Tell us about the importance of that as well.
Well, I really enjoyed, for the past 10 years, I was a clinical instructor for the University of Detroit Mercy. So I was basically a mentor over the senior dentists to make sure that they were doing the best, giving the best treatment to low-income patients. So I think it was important to emphasize public service to the students, as well as to provide a service to patients who will not have insurance and will not be able to receive care.
Doctor, tell us a little bit. You're kind of innovative in this area. Tell us a little bit about your inexpensive method of creating records. This is important.
Well, along with one of my referring specialists, she has given me the opportunity to receive training to offer my patients electronic records. So that way they can have photos of their teeth, their x-rays, even DNA samples, and models of their teeth. So that allows them to carry the records with them to another dentist's office. They can even bring the information to their physician. So it's very inexpensive, and it is, like you said, it is cutting edge.
Boy, things have certainly changed over the years, and I might say for the better. You really enjoy what you're doing, don't you?
I do.
Yeah, I can tell. I can tell.
Thanks so much for this opportunity.
Thank you for being with us. And if you'd like to get a hold of Dr. Fields, our number is right on your screen, as is our website. We certainly hope that you'll give us a call and visit our website. Thanks again, Dr. Fields.
Thank you.
Appreciate it.
I like going to my dentist. He makes me look so pretty. Yeah, right.
Our guest is Dr. Deon Henderson, and we're very pleased to have you here. What made you want to become a dentist?
When I was 15, I got braces, and it did wonders for my teeth. And after that, I'm like, that is what I want to do.
Really? Well, you come from a dental family, I think it's safe to say. Your husband?
Yes, and my father.
Your father-in-law?
Yes.
But you have your own practice.
Yes.
Where are you located? Tell us a little bit about it.
I'm located at 10 Mile and Coolidge in Oak Park, and I've been there for 3 years, but I've been practicing for 11 years.
Now, do you do family dentistry, or are you specializing in any certain field?
Yes, I'm a small family-oriented dental practice where we see patients from ages 2 to 102.
You've been in practice for how long did you say now? 11 years?
Yes.
What have been the big changes you've seen since you first started and up till today?
Oh, the cosmetic dentistry is a big change with the veneers coming, the braces, the Invisalign braces, which is, I provide those for patients as well. And digital radiography is one big change where it delivers less radiation to the patients, and you get to see the x-rays. It's less time. You get to see the x-rays right away, instantly on the computer screen.
Obviously you have to be very, very well educated to do what you do. How much schooling does it take for somebody that may be watching as a young person that would like to get into dentistry?
Well, it takes 4 years of undergraduate college and then 4 more years of dental school.
Deon, what are some of the new technologies that we can see as far as dental work for patients and for people like you?
One of the new advances is implant dentistry, and another thing is oral cancer screening exam, Visalite. We are doing that a lot now, catching oral cancer at its very early stages. So we're very excited about that.
Well, hey, I've certainly learned a lot. I thank you so much for being with us. Deon Henderson, the husband's a dentist, father-in-law's a dentist, all in the family. Yes. We're so happy to have you. Again, tell us where you're located.
Located in Oak Park on 10 Mile and Coolidge Highway.
Okay, thank you so much for being with us. Now, if you're a dentist, we'd love to have you on our program. Be sure and give us a call, the number you see on your screen, and visit our website. And if you're not a dentist, please visit our website and call us anyway. We'd like to get to know you a little bit better. Thanks so much. All of us, every single one of us, has to go to a dentist. Certainly one of the absolute best is Dr. Sharon Stewart from Lathrop Village. Now, Dr. Stewart, you are an orthodontist as compared to what I guess is generally referred to as a family dentist. Tell me the difference between the two.
Well, the difference is I have extended training and a master's degree in orthodontics, which is treatment of crooked teeth, which is braces, and that is all we do. We treat the alignment of the teeth, we treat jaw problems, we treat habits with kids like thumb sucking and tooth grinding. We treat temporomandibular joint dysfunction, which is clicking and popping in the jaw.
Of all of those, what do you think are maybe the most common things? Because I know my dentist has always said, something, you grind your teeth, you got to do something about it. What do you find is the most common thing, and how is it treatable?
Well, grinding is considered an oral habit, and it can occur in children as well as adults. Many children grind their teeth at night, and parents complain about the noise it makes. It can also damage the teeth and wear down the enamel. So the best way to treat it is with a removable appliance that's worn either at night when grinding, or if grinding or clenching occurs during the day, it's worn during the day also.
Dr. Stewart, why is it, especially in this day and age, people are still scared to death to go see a dentist?
Well, the reason is the old-fashioned memories that they have of being in pain, being nervous, or not having the opportunity to have continued dental care in their area. And so they're going in at a time where they are already in pain and apprehensive, trying to catch up. Now, the techniques that are involved in treatment of patients has advanced and continues to advance. The orthodontic appliances are much smaller, much more comfortable, and more advanced. And we have a lot of different options for the type of appliances that patients get now, including Invisalign, which are clear aligners that are worn.
Dr. Stewart, for the layman, like I certainly am, what is Invisalign specifically?
Invisalign is clear aligners that are worn that are specifically made from molds of the patient's mouth that snap in. They appear to be clear. They're changed every 2 weeks to gradually align the teeth, and for people who are concerned about the appearance or the comfort of braces, that's oftentimes an option.
You know, one of the things I would like to mention, Dr. Stewart, is that you have achieved a certain level in your profession that's called a diplomat. What exactly is that?
Well, it's a diplomat of the American Board of Orthodontics, where I had to do case presentation, I had an oral and written examination, and I was critiqued by a group of my peers for a certain status and level of ability and training.
Oh, that's great. Dr. Sharon Stewart, thank you so much for being with us.
Thanks for having me.
Sure.
Enhancing your appearance and self-image can bring out that beautiful smile.
You know, we certainly hear about specialists all the time, but probably the most important aspect of going to the dentist is a dentist that can see your entire family, and you're a family dentist. Tell us about that.
Family dentistry or general dentistry is pretty much self-descriptive. We see a variety of things from cleanings to doing simple restorations, fillings. We also do things such as dentures, bridges, and a great deal of cosmetics.
You know, I think a lot of people associate cosmetic dentistry with being cost prohibitive. That's not the case anymore, is it?
No, it isn't. Once again, the improved materials have come down. They're much easier to use, therefore not as much time is involved, and consequently the fees are reduced because they're easier to use and it's easier procedure.
And everybody wants to have a nice smile, let's face it. Now, I don't know about you, but when you're talking about a family dentistry, you're dealing with the entire family, obviously. And if you're anything like me, you're a big baby. I mean, how do you deal with children who are very apprehensive as well as adults who are apprehensive?
There's a variety of ways and things that we can do. First, we try and introduce, especially for children, we try and introduce them to the office, have them come in and just look around the office prior to doing anything. And this is why it's very important to start bringing children at an early age. So they come to the office having a pleasant experience as opposed to the first time that they come in where they're in pain, and then it becomes a whole traumatic issue after that.
You know, I think one of the important things when you're looking for a family dentist is referrals. And I think that, and this really says a lot about you, Doctor. You have a lot of referral business, which means that your current patients are very, very happy with what you do. And other people say, hey, come on and down and see him. He does good work.
We try and accommodate our patients. We do the best that we can. And yes, we do get a great number of patients. In fact, 90% of our new patients come from referrals. So it tells us that we must be doing something right.
I guess so. Dr. Ron Martella, thank you so much for being with us. And we appreciate getting to know you a little bit better.
My pleasure. Thank you.
Thank you.